You're on.
Hello, I'm Dr. Bittiker. I'm back for our continuing series of programs here. One of the things we're going to be covering today, I ran across some research here, plus I've had a couple requests, so I'm going to cover some information about vitamin C, lysine, liposomal C, and things like that, and the relationship to hardening the arteries and heart disease. You know, the number one killer here in America. There's lots of theories about how this occurs. We have the current theory that you have elevated cholesterol, which is a naturally occurring substance in your bloodstream, and supposedly the cholesterol accumulates on the inside of your arteries, kind of like a scale accumulates on the inside of a pipe in your house because of excess minerals in the water. Well, that's not how it works, and here's how we can prove it. First of all, you have the heart, and you have the big artery leaving the heart, the aorta, and you got the big vein coming back into the heart, the vena cava, and obviously they have the same amount of blood running through the both of them because what goes in has to come out because it goes through the system that circulates through the lungs to pick up the oxygen, then back to the heart, and put out through the rest of the body, and then eventually comes back to the heart after it's given up its oxygen. It's put back through the heart, and the process continues. That's how the pump works. You have two numbers with your blood pressure, the systolic and diastolic pressure. The systolic is the higher number. When your ventricles contract, they pump the blood out to the rest of the body. That's the higher pressure. That's like the 140/80. And then when the heart relaxes, the pressure drops down to, say, 70 or 80 millimeters of mercury. And that's the lower pressure. It doesn't go down to zero, except when you're dead. And but it goes up, it goes down. Just like a regular old-fashioned lever pump. You pump the water out of a hose and it squirts and then it stops and it squirts and it stops. That's the same principle. That's how the heart works. Now, if cholesterol was causing the main cause of plaquing, the hardening of the arteries that leads to heart attacks and strokes, wouldn't the vena cava, and the aorta, they have the same amount of blood running through them, wouldn't they have the same amount of plaque formation in them? But they don't. Same thing with the coronary arteries in the heart itself. There's also coronary veins in there. One has a lot of plaquing, the other has hardly any at all. Why the difference? They got the same amount of cholesterol going through them. Well, the difference is the difference in pressure. Every time the heart contracts, the pressure goes up and the artery expands, just like a balloon, and then it contracts and expands. So 72 times a minute, if that's what your heart rate is, the coronary arteries in your heart expand and then they collapse, and they expand and they collapse. And that causes a lot of wear and tear. Now, your body has certain naturally occurring connective tissue substances such as collagen and elastin. Collagen is the kind of the glue that holds the cells together. Elastin is elastic. It's the stuff that lets it be stretched like a rubber band that allows for that activity to occur. Now, one of the theories, and it's a very good theory because it was promulgated by a guy named Linus Pauling, who won the Nobel Prize 2 times, that hardening the arteries that leads to heart attacks and strokes is nothing but chronic scurvy. I know you think about something the old pirates used to get hundreds of years ago because of a lack of vitamin C. What were the symptoms that the pirates would get? Well, they get gum disease, their gums would bleed, the immune system would be depressed, they would bruise very, very easily, just touch them and leave little fingerprints behind, and they got heart disease and plaquing their arteries, and that's what they usually died from, was heart attacks. Even a young, healthy man, if you deprive him of vitamin C for a longer period of time, will die. The reason being is humans have a mutation that we cannot manufacture vitamin C in our bodies. The other anthropoids, and also guinea pigs and maybe a fruit bat or two, they can't do it either, but all the other animals can. Like, for instance, a Great Dane, 160-pound Great Dane that we used to have, his body manufactured about 6,000 to 9,000 milligrams of vitamin C per day, and by the way, he didn't get hardening of the arteries. It's a pretty rare condition in most other animals. Only humans get it a lot. It's because we have that inability to manufacture vitamin C in our body, at least that's one of the theories. So what happens if the connective tissue, the glue that glues the cells together and the elastic stuff begins to deteriorate? Well, what happens is that little cracks appear in the arteries as they pulse and contract and causes inflammation. The liver senses this and starts to manufacture certain types of thing called LPA, lipoprotein A, which is a type of LDL, low-density lipoprotein. There's 3 major classifications of cholesterol. You ever see on your lab test the total cholesterol level? You got your VLDL, which is very low-density lipoprotein. There's HDL, high-density lipoprotein, and low-density lipoprotein. People get all confused about these ratios. I tell them, forget about that. Vector in on the LDL and the LPA. Why? Because that's the stuff that gets stuck in your artery walls. HDL kind of takes it away from the artery walls. So So you want your LDL numbers to go down and your LPA numbers to go down. But remember, with the inflammation, they go up, along with the homocysteine, which is another measurement, because homocysteine is involved in the manufacture of the actual connective tissue that is the kind of the framework for the arteries themselves. So when this goes up, you get inflammation, and it attracts things such as fibrinogen and the LPA, the cholesterol, to go in there and stick to this area and act as like a spackling compound to seal up the little cracks, and the little foam cells come in and begin to build up plaque in there in an attempt to heal it. So all plaquing in the artery is arteriosclerosis or hardening the arteries. All that is the body's healing mechanism. It's from a chronic vitamin C deficiency. Now, many medical doctors will dispute this chronic medical deficiency, and yet it's funny if you talk to any scientists that send our astronauts into outer space. They know from doing research with the great apes, chimpanzees and things like that, that this 160-pound chimpanzee needs about 6,000 to 9,000 milligrams of vitamin C per day to be healthy. Why would a 160-pound astronaut need the same amount? Because he doesn't manufacture, or she doesn't manufacture vitamin C either. The answer is they do. And that's why the National Aeronautics and Space Administration, they give the astronauts a lot of vitamin C when they're up there. Guarantee you they do. Because they don't want any sick astronauts, and it makes perfectly good sense. So the point being is that vitamin C has a direct effect. What happens is that the LDL, or the lipoprotein A, if it oxidizes, it gets sticky. And also it numbers elevated, because that's the body's mechanism to try and cope with this inflammation. But if you don't have a breakdown of the tissue, in other words, the collagen glues the cells together very good, and the elastin is nice and stretchy, you don't have any inflammation, you don't have any plaque buildup. How do you get that? Well, vitamin C. If you're having any arteriosclerosis or hardening arteries building up in your arteries, you got a vitamin C deficiency. It's just that simple. So you bring your vitamin C levels up to the point where they match what you need, and it varies from person to person. Plus, we add in an amino acid called lysine, which is what stops it acts like Teflon. It's what stops the lipoprotein from getting to be sticky. Plus, it also helps with the manufacture of the framework of the arteries themselves. You can actually stop the plaque formation from building up and begin to reverse it. Now, think I'm making this up? Here's a website you can go to. It's called Pauling Therapy, named after Linus Pauling, the guy that won the Nobel Prize twice, as I mentioned earlier. Pauling Therapy, THERAPY.com, paulingtherapy.com. Now, lest you think that there's not much research, you're going to find out that there's a ton of research backing up what I'm saying here. Let me give an example. 1941, some of this research goes all the way back there to 1941. A cardiologist, Dr. J.C. Patterson, reported that 80% of heart disease patients have low vitamin C levels. We knew that back in 1941. 1954, Dr. J.C. Willis shows that vitamin C supplementation can reduce arterial deposits in the arteries. He's the one that first to make a claim that vitamin C could reverse plaquing the arteries. Here's some another interesting thing. In the 1970s, after Dr. Linus Pauling wrote his book on vitamin C, consumption of vitamin C in America rose 300%. Guess what? Heart attack rates dropped off 30% in that same period of time. We were the only country in the Western world where the heart disease rates went down at that period of time. Everywhere place else they went up because they weren't consuming the vitamin C. Some other studies here. 1992, Dr. Instrom and colleagues at UCLA showed that in over 11,000 Americans, that an increased intake of vitamin C reduces the death rate from heart disease by nearly half and prolongs life for more than 6 years. This is a study done here at UCLA. There's tons more research. I can give you some other stuff here. Here's 1990, even the American Heart Association, 1997 press release reported on German studies that credit vitamin C in the bloodstream with almost completely reversing endothelial dysfunction. That's the lining of the inside of the arteries I was talking about. So that's what we got here. So go to the paulingtherapy.com website. You can see the research there on the use of this. We, in our own practice here, I use this all the time. One of the ways we measure how the artery functions is by laboratory tests. We do the lipid profile, the HDL, LDL. So we give our patients the alpha lipoic acid, which is both a water and fat soluble antioxidant, which decreases the LPA's likelihood of getting sticky. We then give the patient lysine. Typically in Dr. Pauling's protocol, he recommends about 2,000 to 3,000 milligrams of lysine per day. That sounds like a lot, but it's not. He typically also recommends vitamin C, regular ascorbic acid, something where anywhere from 6 to 10,000 milligrams per day of vitamin C, because that's if your body was manufacturing, that's what it would manufacture. That's typically what we'll use on our patients. We also combine it with, say, some nattokinase, taken on an empty stomach, and/or the cerulase, which counteracts the activity of the fibrinogen. Fibrinogen building up is also what causes a tendency to change the charge on the red blood cells to make the blood cells stickier. We also put the patient on some proteolytic enzymes, which make the cells less likely to get sticky. And also, if they have elevated triglycerides, elevated blood fats, triglycerides are much more important than cholesterol, so you want to work on those first. But that's what we'll do for our patients. And we use the laboratory test to indicate we're getting the desired results. Plus, we also do the arterial stiffness test. It's a machine. It's like getting your blood pressure checked. And it measures the elasticity of the arteries and the walls. It's actually a pretty accurate test. And we're able to get a good, clear picture of this. We like that number to be under 60. The manufacturer said they should like it to be under 80, but I see people coming here with 3, 4, 500. They have some major issues. You know, sometimes even people in their 30s and 40s have very high numbers. These people have a proneness for this condition. Almost invariably, the younger people that have the elevated numbers here on the arterial stiffness test, they've almost always got an elevated homocysteine and cardiovascular protein, which are inflammatory markers. Those are dead giveaways that somebody has a significant issue. The good news is you can stop this stuff, you can reverse it. And we use usually the buffered vitamin C. It's a mixed mineral ascorbates, which is the way your body actually normally uses it. This is what we avoid the little problem with diarrhea. And now, one of the things we do, we switched over to some of the liposomal C. Here's the point. The liposomal C is about 10 times more absorbable than the other types of vitamin C. So instead of putting patients on 10 to 12,000 milligrams of vitamin C, we can put them on 1 to 2,000. That's 2 to 4 capsules per day of this. That's all they need. And you get the equivalent almost of an IV drip of vitamin C. Very effective. This absorbs inside the cell 10 times better than this does. And this absorbs about twice as good as regular vitamin C does into the body. You see, probably 80% of your vitamin C ascorbic acid ends up in the colon, 20% in the bloodstream. This, almost 100% goes into the bloodstream, and about 80% of it goes into the cellular membrane. Regular vitamin C, you're down to maybe 10 to 20% actually goes across into the cell membrane and gets inside the cell. And the purpose of that is to stop the advanced glycation products that cause the cells to age. And that's what this does, is it literally slows down the aging of your mitochondria. And you're as old as your mitochondria. Those are the little organelles inside the cells that make your energy. So this is what we recommend for our patients. And go to appallingtherapy.com website, read the research there. Also go to our website, naturalhealthandyou.com. You can see the videos that I did on fibromyalgia, chronic fatigue. You can also go to our catalog there and see what nutritional supplements we have. You don't have to be a patient to order those. In fact, we like it if you do order those. Also, if you have friends that you'd like them to hear this, well, like them and share this with them. And if you have any questions, you wanted me to cover a particular topic, call it 800-326-5838. That's 800-326-5838. And we'd be happy to cover any topic you want. Thanks for watching.
Before you go.
What?
The liposomal C, if you're catching a cold.
Yeah.
Or feeling under the weather.
Yeah, that's one of the things that Pauling Therapy, Linus Pauling found out about. They did some studies at National Institutes of Health that said that vitamin C didn't work that well for colds. They weren't using enough. This stuff, only 2-4 capsules per day, and pretty well does it for most of my patients. Doesn't take much. It's because it's absorbed 10 times as better as regular vitamin C. Not that expensive either. So there's also some contradictory research that shows that the vitamin C does significantly reduce colds and flus.
It does.
Yes, it does. You just got to get the dose right. Vitamin C is very safe.
Okay.
Thanks for watching.